Sound check, this is Deb. Brian, can you hear me? Excellent, thank you.
go ahead and call to order the Finance Committee meeting, for the Cook County Health and Hospital System. Will the secretary please call the roll?
Director Harrington is absent. Director Robinson?
Present.
Chair Ryder?
Here.
You have a quorum.
Heather's here. Thank you, Debbie. I know we have a smaller audience. We moved the meeting. I will note that I was at the special meeting of the county board earlier today to honor our late vice chair and committee member for the Finance Committee, Commissioner Dr. Dennis Deere, and I know we're going to be doing more to honor him at our next board meeting, and we talked about it briefly at our last board meeting. I just, this will be, I think is this our first committee meeting since Dennis passed away?
Yes.
So, you know, one of the things that I would require from Dennis at these meetings is that he would continue his Deere is here, and I would always say, you know, I would always do my writers here, which does not rhyme. But he, you know, as some of you may be surprised, Dennis and I would text quite a bit during meetings, even when he was virtual. So, you know, I know he hasn't been at a committee meeting virtually for a few months, but, you know, it's still also, you know, we were always waiting to see if he was going to pop in on screen or be here in person. So it is still a little jarring. So it's just remembering Dennis again today. And we will continue his good work in everything, you know, that he was focused on in this committee. He was my partner here for seven years. All right. I do not believe that it's necessary to do any remote participation, and we do have quorum. I will note that the next regular meeting of the Finance Committee is scheduled for Thursday, August 15th at 9 a.m. Debbie, do we have any public testimony?
We did not receive any registrations nor any written.
All right. And the first item is the Finance Committee meeting minutes. These were approved by the board at the June meeting, but are being presented for the committee's review and discussion if necessary. Since the committee is me and Sam. Sam, do you have any corrections that you'd like to make to the minutes? Nothing that I'm aware of. Okay. With that, I am going to make a motion to accept the item 3A, the June 14, 2024 Finance Committee meeting minutes. Is there a second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye. 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 The ayes have it. All right, moving along. We're going to go to items under the Chief Procurement Officer. Thankfully, this is one of, not the shortest, but one of the shorter months for moving contracts. We have Charles Jones, our Chief Procurement Officer, who is taking the stage, and it looks like we're going to do Dr. Fegan's items first, according to my notes. So that's request number 2 through 11.
For Dr. Fegan get started, a little housekeeping. 26 items, requires sponsor letters from the Office of Contract Compliance. We have 14 back, 12 in process. Thank you.
Thank you. Claudia, take it away.
Okay, the first one is Stryker, and these are orthopedic supplies and implants. So this is a contract renewal and extension for supplies we use for orthopedic surgery. The next one is to extend and increase a contract also for orthopedic supplies. The vendor is Acumed. These are supplies and implants that we use for orthopedic procedures.
All right.
The next one is extend and increase of a contract for structural heart products and vascular products and accessories. So we're doing increasing numbers of structural heart procedures. These are like valves, porcine valves, and other clips that we are using for increasing structural heart procedures. The next are ablation catheters. So this is when we identify a portion of the heart where there is signal firing that causes irregular rhythms. We very precisely burn that area to prevent that firing and keep the rhythm regular. So these catheters from BioSense, and this is a new contract. The next is for Edwards, and these are trans-aortic valve implants. So these are valves replacing the aortic valve that we're able to insert without having to do an open heart procedure. We're able to insert them using a catheter into the heart itself, and it drops into place. And we're able to replace heart valves in patients who might not otherwise be able to tolerate the surgery. This is a new contract.
Good to know that those things exist.
Hmm?
Good to know that those things exist.
Oh, yes. Actually, we've had such success with the aortic valve, we're now able to, looking at other valves that we can do that for as well. Right. The next one is another Stryker contract. These are for orthopedic and neurosurgical power tools. I was very, I think of orthopedic surgeons as carpenters, but that's my own.
Well, there is a lot. There's a lot of hinges and joints involved in that.
And lots of screws and nuts and bolts.
Yeah.
So this is a multi-year contract for these tools that we need during the surgical procedures. And the next is a cloud-based service. This is for hosting. It allows us to this is Net Health Systems, and it's a service for our EMR. The next is a contract with NuVasive. This is for neurophysiologic monitoring. When we're doing procedures on patients, it's important to be able to monitor them and know that, especially with neurosurgery, that we have not caused any damage or injury, and so we can monitor patients. And as we have our neurocritical care unit, we're doing more of this monitoring. And this is the next is a contract with the University of Illinois, and we do not do transplants at Cook County, but this is the opportunity to have the staff from U of I come and do assessments of our patients who would qualify for transplant. And actually, this is preemptive. So these are patients who we're following who are progressively failing in their kidneys, and this would be the opportunity to refer someone for transplant prior to dialysis, that we might be able to get them transplanted without having to initiate dialysis. And the last one is for with Carl Zeiss Meditech, and this is a contract for Lumera. It's a microscope system that we need to do our work in pathology.
All right. Sam, any questions for Claudia? No questions. Thanks, Claudia. We're going to circle back. Thank you. We're going to circle back to request number 1, which is Aaron Galiner.
Good afternoon. This item is the result of an RFP. It's a 3-year contract for a vendor to provide text messaging solution to our membership, which is the main outreach methodology that we use for a variety of purposes, both education, driving to close care gaps, et cetera. So again, result of an RFP, 3 years for $5.7 million.
All right, that was it. Okay, great. Thanks, Aaron. Sorry, I'm just so used to even you having like 5 contracts. We're going to move to request number 12 and 13 that are being presented by Alex Normington, our interim chief communications and marketing officer.
Good afternoon. I'd like to take those 2 contracts together, if that's okay. They're for our community outreach vendors. These 2 vendors are an extension of our team and represent Cook County Health at community events. This is an extend and increase. It would be the second of our 1-year extensions allowed under this contract. In addition to representing us at community events, these vendors also support redetermination efforts, and at events will actually sit down with Medicaid members and help them complete their redetermination paperwork. When we executed this contract in 2022, we were in the middle of the pandemic and had very low utilization. We did about 170 events a year. That has gone up. We're on pace to do about 600 events this year. So we've got great activity and want to make sure that we have allowances to continue that work. Happy to answer any questions.
Any questions, Sam?
One, I think. Can you give me a little more specific examples of what they do? I'm just curious.
Sure. So if there's health fairs or any opportunity where we can table and share information about Cook County Health, representatives from this organization have been educated and trained, and they go and participate in those events, and they provide attendees information about how to get care at Cook County Health, information about county care. They provide collateral material and represent us, at events across the county. So we get a lot of requests from, schools, from nonprofit groups, from municipalities to provide information about our services, and they'll help staff those events for us.
So during the redetermination, they actually can, if they're at an event and the person says, hey, I want to re-sign up or whatever, then they can sign them up on the spot?
Yeah, so the county care team has a really robust calendar of redetermination events, and the vendors also support those as well, and they'll get on a computer and help them fill out the forms as well. So that was an additional special training, but has proven to be really helpful to give that one-on-one support.
Very good.
Thank you.
All right. Thanks, Alex. We are now going to move to request number 14. Shannon Andrews, our Chief Equity and Inclusion Officer. Just so you know, Shannon, your name was mentioned earlier as well as Craig's, because we were talking recycling, so.
Yeah, all things fun.
Yeah.
Thank you, sir. Good afternoon. The first item I have up is a request to extend and increase a contract with Medline Industries. This is the agency-wide primary distribution of medical and surgical supply contract. This is the second of 2 2-year renewal options, and this request will take us through August of 2026, not to exceed an additional dollar value of $50 million. This contract was originally procured by way of our GPO vendor. Next item, number 15, is a grant-related request. Loyola University serves as a sub-grantee for data collection and analysis for our flexible housing pool work. This request will align our sub-grantee agreement with the funding source, which is to extend this through March of 2025, and it's adding an additional $139,062. And again, it's grant funded. And the next and last item for me is a request to extend and increase a contract that we have with Pitney Bowes. This vendor provides the leasing of equipment and mail postage, as well as mail tracker system for the organization. This request will take us through June of 2025. This is a 12-month extension with an increase of $117,107.
All right.
If there are no questions, thank you.
Thank you, Shannon. We're going to move to request number 17 and 18, Health Information Systems, being presented by Angela O'Banion, our Chief Information Officer.
Good afternoon.
Good afternoon.
The first item is for pagers, a continuation of use of pagers that we use here in the hospital. Healthcare systems, physicians still like to use pagers, and we recommend them as backup systems. They often will receive reception where cellular phones and others don't. And we continue to migrate towards more smart technologies and secure messaging system like the one you approved previously, Tiger Connect, but pagers are still a method of backup for us, so we will continue to use them. The reason it's sole source is because previously the county held the contract, and as time has gone on, county employees and other industries don't have nearly the need as healthcare systems.
Okay.
The next one is for our primary vendor for all of our lab and pathology work, the hardware, software, of course used for patient care, clinical purposes, and also for billing of our lab tests. And this primarily upgrades the current system, entire system, to more cloud-based services, which are have better security parameters, among other things.
So,
SCC.
so I apologize for the tangent. So what is it with the pagers? Is it that it's disconnected from your phone, so it's clear that you're getting a medical alert, or is it just like
That's
a status thing from the 80s?
I doubt that it's a status thing.
House or had a pager.
But it does, it's interesting, NPR and a few other publications and programming have talked about pagers over the last few years. I think one of the publications called them the cockroach of healthcare. They just won't ever die. When one goes off, you do know that it's about the hospital, unlike a phone that you may have that's part of your integrated communication. So it's a way of having isolated communication, knowing that when it goes off, it's for a medical item, whereas if your phone, it could be a lot of different things.
All my alerts, I got so many alerts happening right now. I got one that tells me where my wife is arriving safely somewhere. I got my calendar. I've got all there.
Cook County or City of Chicago, thunderstorm.
You know, people sending me Facebook messages, text messages, people send me messages on Twitter, the platform. I mean, it's crazy.
Yeah.
When you avoid people, they try to get you in all these different platforms.
Yeah.
And then Angela, you also mentioned we've had to deal with some kind of dead zones from a cell standpoint
Yeah.
in the hospital, like in the OR.
There's never going to be 100% a perfect Wi-Fi service, as you know. There's a distributed antenna system throughout, antenna companies, cable companies, whoever you get first, Verizon, et cetera, right? They have this distributed antenna system. And in order for other carriers, whether it's Mobile One or anyone else, to join in to add more and more coverage, they have to pay that carrier a fee.
Right.
Right. So we keep, adding more and more connectivity points, et cetera, but it is, cellular. It's not Ethernet. So there may at times sporadically be zones where even if it's just for 30 seconds, you may not be able to get connection.
So is the pager more reliable on a signal than the cell phone?
It does work. I wouldn't call it more reliable. Some may say so. It's more like a FM station antenna system, so you can get that for a long, long, long time if you're, if you're driving, listening to your radio. So the technology is, you're more likely to get that page than not.
So it's a
AM
page,
was better than that time. You could, I literally once turned on the radio, leaving South Carolina at like 10 o'clock at night to come back to Chicago. I found a radio station, like, oh, it's the same band as Chicago, 780.
Yeah,
I listened to Chicago News Radio 78
for 8 hours.
from Columbia, South Carolina, all the way home.
Yeah.
That's how strong their signal used to be. It's not
Yeah.
they turned it down a little bit, but it's amazing.
Yeah, pagers don't obviously have the level of secure messaging that you can do, that you can get a lot more detailed in something coming over, your phone.
what system does a pager operate on? I've never thought about it before. Is it radio? Is it
It's radio,
infrared?
FM,
It's
a
radio.
lot, cellular, some, have gone to a more cellular network. Some pagers you can do, but it's mostly antenna type, not entirely, but
Interesting.
sort of reminds you of a POTS, a plain old telephone line, if you remember that term.
Yeah.
I do.
All right, thanks.
All right, great, thank you. We're gonna move along to request number 19 through 23, which is going to be presented, I believe, by Craig Williams remotely, our Chief Administrative Officer.
I am remote today, so I'm sorry I can't be there in person, but I can go through my items if you guys can hear me okay.
So you've heard all the recycling talk from earlier, right?
I did, yes.
Okay, great.
And we can absolutely follow up on that.
Okay, thank you.
All right. The first one I have is Granger. It's an increased contract for $5 million for the remainder of the contract term through 11/30/24. And this is to provide institutional supplies to support the facility maintenance and repairs necessary throughout CCH. We actually use Granger for supplies, and we do some small projects with some of their vendors. And so in preparation for Provident and Stroger Joint Commission, we did use them for some projects, which is driving most of this increased contract amount. Okay, next one I have is International Quality Contracting. It's an execute contract for $1,192,000. It's a 36-month contract, 8/1/24 through 7/31/27. And this is to provide patent and maintenance services at ACN clinics as well as the core center. The next one I have is Calumet City Plumbing and Heating. It's an execute contract for $762,000, 36-month contract period, 8/1/24 through 7/31/27. And this is to provide plumbing, maintenance, and repair services for Cook County Health ACHN clinics. It also provides annual inspection of backflow preventers, which is a requirement of replacement equipment under that contract.
All right, Craig, I'm also gonna just have you keep going and do 24, 25, 26 for Donica.
Okay, I'm happy to do that. I think I can't see the screen very now. I think I'm on National Business Furniture right now. Is that correct?
Oh, yeah, do 22 and then jump to 24.
Okay, happy to. So National Business Furniture is an execute contract for $548,176. We're excited about this one. It's a capital purchase, and this is to provide the furniture and equipment for the new Bronzeville Health Center, which will be on 31st Street, opening up likely late 24, early 25. And then I will jump to Jubilant Draximage Radiopharmaceuticals. It's an amended, extended, increased contract for $1,534,000, It's a 12-month contract, 11/1/24 through 10/31/25. And this is for PET radiopharmaceutical supplies for oncology imaging, neuroendocrine malignancy, prostate cancer, and Parkinson's disease. Next one is Hologic Sales and Service. This is an execute contract for $4,484,000. Also excited about this one. It's a one-time capital purchase, and this is to upgrade our mammography devices across Stroger, Providence, Blue Island, Jorge Prieto, and Arlington Heights. And I believe the last one that I'm on for is Cardinal Health. It's an execute contract for $522,000. 36-month contract, 8/1/24 through 7/31/27. And this is to obtain the pharmaceutical Xofigo, the treatment of patients with castration-resistant prostate cancer and symptomatic bone metastases. This is with sole source because it's the only vendor that can provide this product for us.
All right. Thanks, Craig. And now I'm going to move back
Thank you.
to custom number 23, which is going to be presented by Raji Thomas, our interim chief quality officer.
Good afternoon. The request is to extend our current emergency contract with Ovation Healthcare through September 15th, 2024 in an amount not to exceed $2.2 million to continue to provide accreditation and regulatory readiness support. This extension will allow us to complete all the post-survey activities related to the most recent Joint Commission triennial survey at Stroger.
Sam, any questions on this one?
This is a different question. So this is as a result of the recent survey, correct?
Correct.
So-
Sorry.
No, go for it.
They've been providing support since 2021. So this extension will allow us to cover all the post-survey activities. They've been, this extension covers all the activities from March through September. So that's our pre-survey, preparation as well as our post-survey clarifications and, all the activities that are currently occurring to make sure we are compliant with all the findings.
So for the grand total of 2.2, we will complete it. We won't have any more problems, as far as what we know. I'm sorry, that's the amount that's on here. I didn't change any numbers.
Correct. That's what I'm trying to tell.
Yeah, so it's or less, it's a not to exceed value, and they have some, outstanding invoices and stuff from past due that's part of it. So we're not spending $2.2 million in a 6-month period.
Right. So my question is more pertaining to, we do this, we have filled in those gaps that they identified in the survey.
Correct.
I'm sorry.
You're working on it, sorry.
This will close out the survey activity for this round of the triennial. So, we still have a little bit more work to do on the Stroger piece with showing that we're compliant with some of the lower level findings. That'll be getting sent back to Joint Commission in, I think, the next 30 or 60 days, Raj, you wanted to do?
Yeah, by middle of August, we will complete all that. Sorry, I got a little confused. I thought you were asking us if we would have filled the gaps that we had when we asked for this emergency contract.
Okay.
Yeah,
And-
that also will be taken care of. We are developing an internal team that will be able to step in and provide the regulatory support. And as Dr. Mikhaili said, we are in the process of completing all that post-survey clarifications with the Joint Commission, which we hope to complete by middle of August.
Okay. So the intent here is to close out that scope of work with Ovation by September. That'll be the end of that emergency contract.
Okay. Thank you.
Pull a standard changes or something else comes up and then we have to.
Well, the interim,
So something happens in the future that we can't foresee right now.
possibly. However, the plan right now with Raji, she's been doing a nice job building out the team again, in terms of the regulatory piece. We have two more people coming in, and some
Okay.
final candidates
So we
there, and
won't have to
that'll
worry
be,
about it.
it'll be our internal team will be.
Our
full.
internal team,
So,
we won't
yeah.
need to-
But now, I would assume your black belts will find those gaps, right? That's the whole purpose of it.
Not the finding the gaps, it's the helping the team fix the gaps, right? So that's where that's where they're expert, right? And how they improving how we improve, right?
Depends on how you use it. Because if you think about it, how they use it at GE, back when the great CEO that was there really introduced the program, it was to eliminate issues in the quality so that you could predict before, reduce it all the way down to, I can't remember, if it's like a hundredth of an issue or something, but it was negligible if you were able to apply it appropriately. So that's the question I'm asking.
It's all about reducing variation and waste. That's the whole point of what they do.
Okay, okay.
All right. With that, thank you. I'm going to move to approve item 4A, contract and procurement items containing request number 1 through 26, subject to completion of review by contract compliance. Is there a second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. The ayes have it. We're done with that one. All right. Report of emergency purchases. Charles?
Yeah.
None? Oh, okay. I thought I had it one. I got to know that we have one being presented.
You know what,
That's next month.
Well, that's all right. What's that?
It'll be for next month. We just
Okay.
extended this month.
Reported contracts executed under the authority of the CEO.
Yes. So what you have before you is the report of contracts under authority of the interim chief executive officer under $150,000 for the second quarter of this year, March, April, and May. It's a total of 19 contracts presented here. All, we received responsive letters from the Office of Contract Compliance. A little bit of summary of these items. 9 of these contracts were capital equipment purchases as we look to buy down, spend down our FY24 capital funding. 7 of the 19 were GPO vendors. And just looking a little bit at some of the higher dollar ones, the first one, bioelectric laboratories with test kits for COVID screening clinics for $127,000. GE Technology Information Technology was, we bought Central Stations monitors for the OR here at Stroger, $149,000. Gettinger was another GPO contract where we bought catheters and accessories for the OR, $120,000. Leonard Merchant Ltd. Legal services in connection with Equal Opportunity Employee Commission, the Illinois Department of Human Rights, and the Cook County Commission on Human Rights, $149,000 contract. And then been to the last page, Debbie, National Roofing Corp. was a $145,000 contract for inspection, maintenance, and material allocations for 7 of our ACHN clinics and health centers. Any questions on this report? And thank you.
All right. Thank you, Charles. I'm going to move now to items under the Chief Financial Officer, presented by our Chief Financial Officer, Pam Casara. I believe the first thing we have on the agenda is receive and file grant award related items.
That is correct. Good afternoon. Before you have the receive and file Cook County Health Grant Awards and renewals. Just a couple awards this month totaling $332,000. 1 renewal and 2 increase and extend for small dollars. If there's any questions, I do know Dr. Fegan left, but we can get back to you if there are any. Anything? Nope. Hearing none?
So I'm going to move to receive and file item 5A, the grant award related items.
Second.
Motion's been made and seconded. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Guys have it. All right. Transfer of funds.
Yes.
That was that.
Mm-hmm. And the next item before you, if you can make it a little bigger, thanks, Debbie, is a request for transfer of funds. Again, this transfer, what we do here is move monies around in the from taking from one area and giving to another that has been short on funds. You can see here that we are requesting a transfer of $10 million. You may recall about 2 months ago in May, we also requested a transfer of about the same amount, $10 million. And this is all going to primarily cover the costs of the new arrivals. So we budgeted about $25 million for new arrivals this year. That was based on last year's actual spend, but we are projecting to actually be about $45 million. Craig and team had originally projected about 50, but there's been a lull lately in the last several weeks since the president made some restrictions on folks coming across the border. So we are in a bit of a lull and have revised that projection to $45 million, but that still makes us short $20 million basically. And we have to move money to cover that. Any questions?
Any questions on this? All right, I will move to receive and file item 5B, the transfer of funds. Is there a second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? You guys have it. We're going to move now to the May financials.
Yes. So before you, we have the report for the 6 months ended May 31st, or halfway through the year. We are still $179.3 million favorable on an accrual basis and $120.5 million favorable on a cash basis. The reasons have remained the same, and this is a good segue into the upcoming budget and mid-year hearings that we'll be having. Why are we so favorable? And I think it's important as we go into the next year's budget that you understand the underlying reasons, right? And so next slide, Debbie. As we look at the financials, you can see $380.7 million favorable revenue variance, and you can see the adjusted NPSR line, which is from the hospital and clinic side of the house, $42 million favorable. And that is coming from a combination of volume increases related to our strategic initiatives, expanding the service lines, the cancer, neuro, and cardiac service lines, as well as the improvement or the continued shift in payer mix and due to the pause on redetermination and that folks were able to retain their Medicaid coverage. We'll look at that when we look at the payer mix slide. And then on the county care slide, you can see they're sort of the same reasons, right? During the pandemic, folks didn't have to go through redetermination, were able to retain their coverage, and their membership has just way exceeded their budgeted membership. We haven't seen the declines we had budgeted for. Erin's actually going to give a report to the board that shows an over 80% retention rate, almost 90. Director Robinson, almost 90. I won't spoil his thunder there, but very, very, very good retention rate. So those two things are really contributing to the positive revenue variance. And then on the expense side, we do have a surplus in the salaries and benefits line, which has to do with the issues we've had around hiring, partially. But that is also being offset by the higher than budgeted medical claims expense line that goes along with the county care membership. But so those are the primary driving factors, both on the revenue expense side, that are driving the bottom line. Next slide.
May I ask a question?
Sure.
Back with the increase on the service lines, and you said it's a direct function of the strategic.
Yes.
Can you say a little bit more? I find that interesting.
Yeah, yes. I mean, Andrea Gibson has come several times and given updates on the strategic initiatives, but that was most of the budgeted strategies for this year were around expanding services at Providence. We reopened the ambulance runs, we reopened the ICU. We're trying to increase women's services and GI services out there. So those are some of the ones around Providence. And then at Stroger as well, there's, again, the service lines, neuro, the cardiac procedures that Dr. Fegan spoke to, right? The TAVRs and the miter clips and things like that. So we've put, concerted effort specific to specific initiatives to try to expand those service lines.
So essentially, these were needs that were being unmet, and we had the population, but we just didn't, for whatever reason, have ability or took advantage of the opportunity to fill those gaps.
Right.
Very good.
Yep.
Excellent.
Mhm. And next slide. You can see that here, all the key drivers on the statistics side are ahead of budget, with the exception of surgeries are still just a tiny bit behind. And as I think I mentioned last month, that negative variance in surgeries is really equates to like one surgery per day at each facility. So or less than one, honestly. If we would, basically meaning if they had done one more surgery per day since December 1st to present, they'd be meeting that benchmark. Now, there's several reasons for why they haven't, some having to do with lack of providers, but also efficiency in the OR, which there are also initiatives around with Raji and her team looking at, throughput, right, and block times and on-time starts and, all kinds of things and reasons why surgeries get behind. And there are work groups, working on that. Sorry, used the same word twice. But yeah, there are groups working on improving the efficiencies. Next slide. So here again is just those statistics shown over time, which again is important as we come to you next week and introduce the budget, because we do look back, right? We look back and to see what happened. We look at, are we meeting our budget this year? And then we look forward to what's going to happen next year, and make some assumptions on, what's the future of healthcare, what are the reimbursement things coming down the pike, and again, then we layer on any additional strategies on top of that for next year's budget. And we'll talk more about that next week. Next slide. So here's that payer mix slide again, and here again, you can see that the Medicaid the last few years, as we've had that pause on redetermination and folks were able to retain their coverage, in addition to the Medicaid expansion to our immigrant population, our Medicaid has continued to grow. This year we have seen a slight downtick related to the redetermination process, and an uptick in the uncompensated. However, that redetermination process is just about over, and we hope it'll sort of just level out and stay at the current level or about the 22 level and won't deteriorate from there.
I'm curious on the uncompensated.
Mm-hmm.
Do we have a good understanding as to that composition? Do we know that these people are truly not able to be insured versus they just haven't done it?
Right. So we have a pretty robust financial counseling program who, works with the patients to get them signed up for any coverage, whether it's charity or Medicaid or whatever. We have a pretty robust program to capture all that, yes. Which is again, goes back to why the revenue side is so good, right? And which is a perfect segue into the next slide, which starts to go into rev cycle. Now, rev cycle's behind through May because of the Change Healthcare breach. We had to hold all billing for about almost 8 weeks. And when we started that billing, and the payers started to pay us, then we couldn't post the payments. And we're still in that period where we've just started posting the payments because the tool that we used to post the payments didn't work either. So their key performance indicators, the KPI, their benchmarking is out of whack, but we do, and cash especially, right, was not coming in the door for about 8 weeks. But prior to that, it's when Chief Revenue Officer Curtis Haley came and gave his report, you saw the phenomenal improvements that we've shown in collecting the cash we're entitled to over the last several years, which was never really a focus. And it's not just collecting the cash, from the payers, but the whole front end to back end process, right? Making sure people are registered with the proper insurance at the front end. Making sure we get the proper authorization from the payer so that it's not denied. There's just so many steps, right, to make sure that we get paid properly. And then even the payers themselves sometimes drag their feet, right, on on, getting us payment and making sure, you know, we're constantly on top of them and working with them to get payment, to get our payment. So, so again, you know, volume due to the strategic initiatives, Medicaid, pause and redetermination plus expansion, and then revenue cycle improvements, I would say are the top 4 reasons. If you're asked why CCH is doing so well, that is primarily the reason.
Okay, just a quick question on the uncompensated care piece, which I understand we've done really well with that over the years. Is what we're looking at now in terms of what's constituting uncompensated care, parts where there's gaps in people's coverage, so services that are not being covered for someone who otherwise has insurance or Medicare, and their inability to pay for that service or meet the co-pays or whatever. Is that what it number?
So uncompensated care is a combination of charity and bad debt, right? And charity is those who cannot pay, and bad debt is those who will not pay.
Right.
And there's some of both. And with the shift from Medicaid to charity, it's because maybe now they don't qualify for Medicaid any longer due to income or whatever.
Sure, they
you know,
yep.
And or they just haven't done their paperwork. And if they haven't done their paperwork and they cross our doorstep, we help with that for sure. But the ones that no longer qualify for Medicaid and do now fall to charity, there's some legitimate group of those as well.
Yeah, I guess the number that, so someone has a copay on a procedure and they don't make that copay, so it's partially covered by whoever whether it's Blue Cross or it's the government.
Right.
That portion that's bad debt on that falls into so they have insurance, but their insurance isn't covering everything, and they're not paying their
right.
their side of it.
Right. And then we do not pursue collections for that. So that would fall to bad debt.
Okay. All right.
Here's a question about the collections. I think sometime earlier in the year, we talked about this international firm. How is that impacting this number?
Well, that contract is actually not in place yet, but we're very, very close, right, Charles? Well, we don't know yet, is the answer, but we should know in the coming months.
So we should, when the contract gets in place, then they will be able to execute, which then hopefully this can improve.
Yeah, we'll see. You know, it's a contingency contract, right, Charles? Yeah. Yeah. So we're ready to start now.
Okay.
Yep. And then we'll know in a few months.
Exciting. Can't wait to hear this.
All right, next slide. This one, the denials, as I spoke to, they've been able to keep on top of due to better controls and processes, again, on the front end, making sure we're registering folks correctly in the first place. The denials overall, the benchmark is to be less than 2% of collections, and they're hitting that. You know, the Medicare and Medicaid trending down. But just the total reasons, the bottom right graph there, just the total reasons overall going down. So again, continued improvement.
So you're saying the denials are 0.2%?
Yes.
We call that perfect. That's pretty darn good.
It's pretty good. It's very, very good.
That's very good.
Yep. Next slide. Charity and public program expenditures. You know, this one just trends over time to illustrate beyond the traditional charity care and bad debt that we've been talking about, all the other things that CCH does for the community of Cook County. So CIRMAC and Department of Public Health and all the other services we provide as well. You can see that in terms of total dollars, it's pretty consistent across the years. The charity care, again, there is an uptick right now, but this is just year-to-date annualized, and we're projecting, so 6 months times 2, basically, and that could come down as through the latter half of the year. Next slide.
I'm sorry, I want to say
Sure.
more of a thing. You kind of you didn't really want to do a victory lap with me on that 0.2%. We have to call it what it is. That's extremely good. I
That
mean,
is
it's
very
like fantastic. Whoever's doing that, they're doing it.
Yes.
They're doing it extremely well.
Yes.
So I think you deserve a clap for it. It's hard to get that.
What was our denial rate?
I don't recall. I'd have to go back. Curtis isn't on today. He's out this afternoon, so he could probably tell us off the top of his head, but it was high. It was
Very high.
Yeah, it's very high. And it was generally, I would say, categorized as just sloppiness, right? Just not, registering people correctly, following through on accounts, and just a lot of cleanup.
But you did it.
But we're there. We're there. He would say we're not quite there yet because we're going for the MAP award, which benchmarks us against all like-sized facilities in the country. And I think he hopes that by next year we'll be able to apply for that. All right, next one. Savings initiative. So here too, we're a little behind. What?
We're applying, we've gotten to the point where we're applying for an award.
Yes. That strike is funny. Well, I guess so. Well,
Yeah,
we wouldn't-
I mean, again, I've been here for 7 years, so.
Yeah. And we hope to get it, so. All right, so savings initiatives here.
I'm just you're in a position to apply for it.
Here too, we're lagging behind a little due to rev cycle and due to the Change Healthcare breach. We would hope to be halfway through or 6/12, but we're at 35%. And the two items that are yellow has to do with rev cycle. So, but we do think we'll get that caught up by the end of the fiscal year. And then last but not least, county care. Again, they are doing extremely well on the membership, the bar graph at the bottom. The darker red is the core membership, if you will, and the lighter red is that HBIA, HBIS that began to be auto-enrolled in the beginning of January. You can see that it has started to tick down a little in May. And again, I think, and Aaron can speak to this if desired, and again in June. And then hopefully, we'll level out after that. But they are financially basically at their budget at break even. And again, just the membership tells a story here. Any questions on county care?
I don't have any questions. Dan, you good?
I'm good.
All right.
Thank you.
I'm looking at this thing, looking at the clock. There's only one course of action I can take at this point. The agenda's exhausted, so we're adjourned. Thanks. Everyone's sort of like looking. Yeah, does that? Good stuff. Let it bounce. You don't have to swing. You don't have to do that. You don't have to do that. Yeah, you don't have to have. It's better when kids don't bounce. Oh, yeah.